A low nasal bridge is where the bridge of the nose is lower than usual. The nasal bridge connects the upper nose to the forehead. In low nasal bridge cases, this area appears flat or depressed. It can be genetic or develop later in life. It's mainly a cosmetic concern, not a medical issue. Sometimes it's linked to genetic conditions. Consult a doctor if you have concerns or breathing issues. It can be called a flat, depressed, or saddle nose. Saddle nose describes a sunken nasal bridge. These terms are often used interchangeably. Understanding a low nasal bridge helps in making informed health decisions. A low nasal bridge can be caused by a variety of factors, both genetic and non-genetic. Genetic factors are those that are inherited from parents, while non-genetic factors are those that are acquired after birth. One of the most common genetic causes of a low nasal bridge is a family history of the trait. If one or both parents have a low nasal bridge, their children are more likely to inherit this feature. Certain genetic disorders can also lead to a low nasal bridge. For instance, Cleidocranial dysostosis, a condition affecting the development of bones and teeth, often results in a low nasal bridge. Down syndrome, a genetic disorder caused by the presence of an extra chromosome 21, is another condition associated with a low nasal bridge. Williams syndrome, a developmental disorder that affects many parts of the body, can also lead to this facial feature. In some cases, medical conditions like congenital syphilis or untreated clefts can affect nasal development, resulting in a low bridge. Furthermore, certain autoimmune diseases that attack the body's own tissues, such as Wegener's granulomatosis, can also cause inflammation and damage to the nasal cartilage, leading to a saddle nose deformity. It's important to differentiate between these causes to determine the most appropriate course of treatment. A low nasal bridge itself doesn't typically cause any symptoms beyond the noticeable difference in appearance. It's primarily a cosmetic concern for individuals who may feel self-conscious about the shape of their nose. However, if the low nasal bridge is a result of an underlying medical condition, there might be associated symptoms. For instance, if the low bridge is due to a nasal fracture, individuals may experience pain, swelling, bruising, and difficulty breathing through the nose. Infections can cause nasal congestion, discharge, and pain. In cases of autoimmune diseases, there might be systemic symptoms like fatigue, joint pain, and skin rashes. Diagnosing a low nasal bridge is usually straightforward and involves a physical examination of the nose by a doctor. They will visually assess the nasal structure and may feel the bridge to check for any deformities or irregularities. If an underlying medical condition is suspected, further investigations might be necessary. This could include imaging tests like X-rays or CT scans to visualize the nasal bones and cartilage. Blood tests might be ordered to check for infections or autoimmune markers. Early diagnosis and treatment of any underlying conditions can help prevent further complications and preserve nasal function. Treatment for a low nasal bridge depends on the cause and individual concerns. If it's cosmetic and not causing functional issues, treatment might not be necessary. Cosmetic surgery like rhinoplasty can reshape the nose. Rhinoplasty uses cartilage grafts, bone grafts, or implants. Non-surgical options like dermal fillers offer temporary augmentation. Fillers require repeat treatments. For medical conditions, treating the underlying cause is crucial. Follow-up appointments are essential for successful management.